Welcome to Lesson 6 of Module 1 on DBMS extensions and example data warehouses. I'm going to start with an important usage question about medical data warehouses. What factors inhibit usage of federated medical data warehouses such as SafetyNet? Lesson 6 provides conceptual background about data warehouses deployed in organizations to provide a context for detailed skills in other modules. You will learn about a standard medical data warehouse model and a substantial implementation of the model to support healthcare researchers. You have 3 learning objectives in this lesson. You should understand the scope of moderate-sized data warehouses. You should gain insight about development difficulties with cooperation among independent data providers. You should reflect about the lack of incentives for voluntary participation by data providers and usage difficulties by stakeholders. The Observational Medical Outcomes Partnership, or OMOP, was a public/private partnership to develop and promote standards for electronic medical records. The primary products of the partnership were standard vocabulary and a common data model for observational medical data. Secondary products were data integration procedures, standard queries to use the data model, and data generation procedures to populate a data warehouse with simulated data. An active community of users has applied and documented usage of these products in conferences and publications. The original OMOP investigators have moved to new projects to promote innovation and usage of medical evidence and develop open source tools for observational medical data. The OMOP Common Data Model is a constellation schema containing 37 tables with some freestanding tables. Each star in the constellation contains person and time dimensions. Other dimensions are providers, cohorts, locations, organizations, care sites, and payer plans. Major fact tables are treatments with drug prescriptions and procedures and occurrences of observations, visits, conditions, exposures, and deaths. This diagram from the OMOP website shows the OMOP 5.0 Common Data Model specification. The specification contains standard areas for clinical data, healthcare economics, healthcare system, vocabulary, and derived elements. This diagram shows the tables in the Common Data Model, although not organized in a traditional schema diagram. This schema diagram, from the website of the Observational Health Data Sciences and Informatics, shows details of the OMOP Common Data Model for standardized clinical data. To see the diagram clearly, you should enlarge the diagram in the associated PowerPoint file. The diagram uses a key symbol by a parent table and an infinity symbol by the related child table. The schema diagram contains a constellation schema with various fact tables, such as procedure occurrence and death, and 2 dimensions, person and observation period. The OMOP Common Data Model contains variation from the standardized schema patterns. The data model for the standardized clinical data contains many-to-many relationships, rather than just one-to-many relationships in the standard schema patterns. Person is the dimension table with one-to-many relationships to 3 major fact tables: visit occurrence, death, and specimen. The other fact tables have one-to-many relationships with visit occurrence and person. For example, one-to-many relationships exist from person and visit occurrence to measurement and observation. Measurement and observation are associative entity types representing many-to-many relationships. Thus, the ERD for the standardized clinical data complicates the standard schema patterns with many-to-many relationships. The scalable architecture for federated translational inquiries network, known as SafetyNet, is a substantial implementation of the OMOP Common Data Model. SafetyNet was developed to support comparative effectiveness research and quality improvement research using data collected from independent medical providers distributed across geographic regions. SafetyNet provides data integration tools to transform data from providers and a query portal for researchers using the data warehouse. The SafetyNet data model is a subset of the OMOP Common Data Model. SafetyNet contains dimensions for person, provider, organization, care site, and time. These dimensions are really the fact tables for visits, conditions, deaths, procedures, and observations. Although the data model seems modest, lack of incentives for data providers and data integration difficulties prevented development of a larger subset of the Common Data Model. SafetyNet was developed as a research project so the tedious details of data integration and incentives for data providers were difficult to manage. The organizational effort to establish SafetyNet is at least as much of an achievement as the data warehouse development. SafetyNet is populated with data from 14 healthcare organizations, 100 primary care practices, 500 providers, and 400,000 patients. Claims data comes from 3 U.S. states. Governance committees were created to coordinate participation by data providers and usage by researchers. SafetyNet has usage barriers with approvals by internal review boards and data providers. Lesson 6 presented standards for medical data warehouses to provide a context for detailed concepts and skills covered in other modules. The Observational Medical Outcomes Partnership, known as OMOP, created a standard vocabulary, common data model, data integration procedures, and query suite to support development of medical data warehouses with observational data. You are encouraged to learn more details from the OMOP website. The Scalable Architecture for Federated Translational Inquiries Network, known as SafetyNet, implemented a subset of the OMOP Common Data Model to support medical researchers who want access to medical observations from a diverse collection of providers, patients, and organizations. In answer to the opening question, internal review boards and lack of incentives for data providers inhibit usage of SafetyNet. SafetyNet promises economies of scale for research using medical records from a diverse network of patients, providers, and locations. Due to usage difficulties, this promise has not been entirely met. Each research project must obtain clearance by an internal review board. Internal review boards require a detailed justification about data requested and safeguards to meet strict privacy standards. Data providers lack incentives to participate in SafetyNet and approve access to data. Research projects using SafetyNet can only provide intangible and long-term benefits to data providers. Thus, SafetyNet's impact is more limited than the Colorado Education Data Warehouse, although lessons learned from the SafetyNet experience will be valuable in the future.